Welcome to the Health and Wellness Show. This is Paul Hambleton. Today we're going to be talking about sleep disorders and breathing disorders. We're going to do this from the perspective of a naturopathic doctor. Today I have Dr. Caroline Meyer with me. Welcome to the show.
Thanks for inviting me, Paul. I'm happy to be here.
It's a pleasure. Great. It's a pleasure to have you here. Before we start in on our chat about sleep disorders, breathing disorders, I was wondering if you could tell us a little bit about why you decided to become a naturopathic doctor in the first place.
Yeah, well, I think my story is similar to many of my colleagues in the healing profession. I started out as someone who was sick, and in my late 20s, I was getting lots of different illnesses, and then I developed asthma and depression, and I was, just going to the doctor constantly. And I thought, I'm a young woman, and I feel like my health is declining quite rapidly. So a friend of mine recommended for me to see a naturopath, and I really didn't know much about the profession, so I went to see this naturopath. And in working with her, not only did my health improve, but the proverbial light bulb went off in my head. I was like, this is what I'm meant to do. And so from there, I went to naturopathic college, and now practice as a naturopath.
Terrific, terrific. I think a lot of naturopaths have a similar type of story that they've had firsthand personal experience, and that's what's drawn them into the practice.
Mm-hmm. Yes, indeed, yeah.
Do you have a particular focus in your practice?
I do have a few areas of focus. I see a lot of children in my practice for a variety of different conditions, as well as healthy kids who their parents bring to see me to monitor their health. I do see a lot of people also with different mental health concerns, depression, anxiety, trauma. Really what I love doing is I love working with people to help them get to their peak of health, however they define that, using a variety of natural medicines. And my happiest day is always when I get to say to a patient, that we don't really need to meet anytime soon because they are healthy and have all the tools they need to go out and enjoy their life. So that's why I love doing what I do.
And once they're in that state, then it's more maintaining as opposed to a more concentrated effort to get to that point.
Yeah, exactly. So always trying to get to that point. Many times you can achieve that. It's really great.
That's great. That must be great satisfaction for you.
Oh, of course, yes. Love what I do.
So I imagine there's a fair bit of training and education that's been required to get to your level of expertise.
Yes. In Ontario in particular and other licensed provinces and states, there's a minimum amount of education that a naturopath would have. So for myself, I did an undergrad degree as well as some pre-med courses, and then went to naturopathic college, which is 4 years of full-time study, including a year of clinical internship. And then since graduation, doing continuing education programs. There definitely are in unlicensed areas, say in Quebec, New Brunswick, other places in the United States, where someone can put up a sign outside and call themselves a naturopath, and they might have a different level or less education than someone, say, in Ontario, who would call themselves a naturopath. So it does involve quite a bit of education, medical education.
So it's much more regulated. It's much more regulated.
Yeah, exactly. Yeah. So in Ontario, if someone has a sign out saying they're a naturopath, they will have had the minimum sort of 7 years of post-secondary education to call themselves a naturopath.
That's quite a lot of education post grad.
Mm-hmm. And it's lifelong learning. That's the other great thing about it.
Well, that's the thing.
Yeah.
That's the thing too. Keeping on top of the latest developments and furthering your education is part of the process too.
Oh, certainly, yes, yeah. And with the internet, that's a tall task sometimes to keep up with all the information. Yeah.
I was wondering what type of sleep disorders or breathing disorders have you seen in your practice?
I would say, obviously most common is insomnia, whether that's like an onset type, a maintenance type, or a mixed type, where people have problems getting to sleep and staying asleep. That would be probably the most common sleeping disorder. I do see people with sleep apnea as well, so sort of like it is, I guess, considered like a sleep/breathing disorder. I have treated also some people with narcolepsy, so with, sort of sudden daytime sleepiness. As I mentioned, I see a lot of kids in my practice, so I've seen kids with night terrors, sleepwalking, other kinds of sort of sleep disorders like that. But insomnia is a very common concern in general that people come in with.
How might sleep or breathing disorders that you've seen, how might they be affected by the hormones?
Well, in my opinion, I think all the hormones in our body have some relationship to the quality of our sleep. But I would say chief among them would be melatonin. Probably a lot of people have heard of melatonin and maybe even take a melatonin supplement. But it is a chemical, a hormone that's released in our brain at night when it's dark that helps us in some way maintain sleep. Really, honestly, sleep is still, the more we know about it, the more we don't know about it. We're still even trying to figure out like why humans need sleep. We know that we need it, but there's a little bit of mystery still about why we need it, how much we need. But certainly melatonin is key, is a key hormone in helping with sleep. Cortisol, which is sort of what's produced when we're under stress, is also related to the quality of our sleep. So if we're really stressed out and our cortisol is just pumping away, it certainly can impact negatively the quality of our sleep. A lot of people will relate to that. It's 11 o'clock, 12 o'clock, and I'm still feeling quite wired and not ready for sleep. But I know I need to get up in the morning to go to work or school. That might indicate that your cortisol is actually too high in the evening, and you're going to have a really hard time settling down to sleep. I'm sure a lot of women of a certain age, in their late 40s, 50s, can relate to perimenopause, menopause, and having sleep problems. It's one of the most common complaints I hear from women who are going through that change, that hormonal change.
Yes.
And a lot of that can be related to the estrogen and progesterone levels changing with menopause. And even men, we talk about this concept of andropause, but men as they age, if their testosterone becomes too low, it also can affect their sleep, and they sort of mention like not having really deep restful sleep when their testosterone levels are low. So as I mentioned, then all the hormones are in some way can be related to the quality of your sleep. And by balancing your hormones, you can often see vast improvements in your sleep.
Great. So we're going to get to that a bit more in a minute. I'd like to move on and talk about toxicity and how that might relate to sleep or breathing disorders.
Yeah, it's an interesting question. I was thinking about this earlier, and I was, in traditional Chinese medicine, they think that the time of day that the maximum detoxification that's happening in the body is from 11 p.m. to 3 a.m. That's the time when the liver and the gallbladder are thought to be most active. And so it's sort of interesting, that's sort of a time, hopefully, when most of us are trying to get some sleep. So even from an Eastern perspective, they would say that if you're not sleeping well, then you're actually interfering with your body's ability to detox, and thus creating more toxicity in the body. You can look at it from another angle, too, and certainly what I've seen, especially with young kids who maybe have higher levels of heavy metals, so lead, mercury, copper, those conditions have been associated with different problems with the nervous system, including sleep. So sometimes when people have actually what we might call heavy metal toxicity, it can certainly negatively impact their sleep. And again, too, as you can correct this, then their sleep improves. So yeah, in that way, I think toxicity can be related to sleep problems.
And another area would be inflammation, perhaps. That's inflammation throughout the entire body. Do you see that has an effect?
I think as we're learning more about inflammation, we realize how it's involved in so many chronic health conditions. I think it is kind of like a chicken and egg thing, in the sense that studies after study have shown that people who, even short-term insomnia, but certainly with chronic insomnia, they have higher levels of inflammatory molecules in their blood. So it seems that having lack of sleep or sleep problems over time increases inflammation in your body. And that's a pretty clear connection. As I said, many studies have confirmed this. The other side of that is certain sort of conditions that we might consider sort of whole body inflammation, like heart disease, diabetes, rheumatoid arthritis, other kind of rheumatological conditions like that, where we can see that sort of when there's inflammation in the body, when people have these medical conditions, they often report having sleeping problems. So there's definitely a connection between inflammation and chronic sleep problems.
So if these chronic sleep problems aren't treated properly, sleep or breathing problems, are those some of the issues, the related health issues that might be associated with those conditions?
Yeah, definitely. I remember when I was a student, spent some time in this cardiac rehab clinic studying with them. And it was interesting, the doctor who was holding a diabetes clinic that day asked every patient, we must have asked 20, 30 patients in a row, do you have sleep apnea? Do you snore really loudly at night? And out of the 30 people, probably like 28 of them said they either had a diagnosis of sleep apnea or they snored they probably had sleep apnea but not yet diagnosed. And he said that he saw this connection very strong. And so he was saying, in his mind, either, addressing the sleep apnea could be potentially a potent treatment to prevent people from actually developing diabetes. Or conversely, too, treating the diabetes can help to improve the sleep apnea. So definitely, and lots of other studies showing, with sleep deprivation studies showing that you can induce chronic pain in people's bodies with chronic sleep deprivation. There's definitely a link. There seems to be a link between mood disorders like depression, anxiety, and sleep quality. Heart disease, your risk of heart disease, and really just your risk of having an early death is higher if you have chronic insomnia from any cause. So it's definitely, sleep is something sometimes we take for granted, but it's such a foundation of health that really needs to be addressed.
As you just discussed, there's so many different possible related health challenges that are tied to it, and certainly something that needs to be diagnosed properly and then treated.
Certainly, yeah. And
so
also,
sure, continue on.
I was thinking also for people to recognize, because I think sometimes, maybe because my private practice is in Toronto, a very busy urban place, sometimes people don't actually realize that they are sleep deprived. They feel like, well, if I get 5.5 hours good sleep, then I'm okay. And it's like, well, maybe not. Maybe you actually need a little bit more sleep. So sometimes it's actually helping patients recognize the importance of sort of really good quality sleep as part of their health plan.
Yeah, it's part of their lifestyle and what areas that they work in and what type of work that they may have that contribute to it, just like you suggested.
Yeah, and also I was just also thinking too, going back to the idea of the hormonal connection to sleep. People who work shift work, consistently has been shown it really does negatively impact your melatonin levels. And melatonin is very important for sleep. It's one of the main triggers that, helps us to get into that deep restorative sleep. But it's also been shown to be important for the prevention of cancer, for example. So people who have chronically low levels of melatonin sometimes put themselves at greater risk of developing particularly breast cancer. So, when you're working shifts, you really want to look at, how sustainable that might be and how to really have very good quality sleep while you're working, different hours.
I find that very interesting with the connection there that you just mentioned. That's very interesting.
Yeah, and not necessarily, I don't want to leave people with the impression that, okay, if my melatonin's low, then I'm definitely going to have cancer, but there definitely seems to be some sort of connection there to consider with melatonin and particularly breast cancer.
Certainly, certainly. So if somebody came to your clinic with a sleep disorder or a breathing disorder, how might you treat them?
Uh, with naturopathic medicine, we are always kind of trying to find the underlying cause of, a person's symptoms and their medical conditions. So for me, too, it's very important to understand what they're doing on a daily basis. I think, the culmination of our daily habits has a huge impact on our overall wellness and state of health. So usually what I'll look at is, again, what is their daily routine and nightly routine? What is their diet like? There's certain foods that are going to be a little more conducive to helping you sleep more soundly. Looking at physical activity, certainly considering the mind-body connection and what they're doing to help them relax, to experience joy in their life. Also, to and then from that foundation, looking at using acupuncture or perhaps some herbs or homeopathic remedies to sort of assist with the proper sleep. So really, it's from the foundation of lifestyle and daily habits, we build upon that with adding some more individualized kind of treatments, depending on why the person's having a problem with sleep.
So once you've addressed some of the core issues that may be causing the sleep problems, and then the sleep problems will hopefully diminish, and they can help hopefully maintain that adjusted lifestyle to help have a regular, proper sleeping regimen.
Exactly. I think as adults, if you I don't know if you have young children or any of your audience has babies, but when you see babies, they respond so well to daily routine. And if you say take their afternoon nap out, you think, oh, they're going to be tired at night, they're going to sleep better. But if you disrupt their daily routine, they actually sleep more poorly at night that day, that they don't have that nap. So I think as adults, we kind of get out of that habit. We kind of think, oh, we can stay up late, or we can eat a whole pizza, and go to bed, or watch the UFC, Ultimate Fighting on TV and go to bed. And, it often doesn't happen. Some people are blessed with, a gift to sleep anytime, anywhere. But I think a lot of us need that routine in our day to help us, sleep soundly and properly. So that's what I strongly encourage.
So that's part of what you would do with a patient is you'd look at what their routine is like, and if there's erraticness in their routine or whether or not there's some consistency, and help to identify some of those potential areas of concern, and helping them to moderate that a bit, particularly if they have a sleep disorder in an attempt to get things balanced.
Yes, exactly.
So overall, how would your approach to these sleep disorders or breathing disorders, how can that contribute to overall wellness that you're looking to achieve and help patients to achieve?
Well, I think we all can, it's normal to experience nights of sleeplessness or little sleep, and probably most of us could say, well, I can get through the next day, but I'm certainly not feeling at my best. And certainly people who have ongoing sleep or breathing problems, it really can negatively affect their life in many ways, that they're emotionally, physically, certainly. So by addressing the sleep, breathing disorders, inevitably you're going to improve their overall wellness. As I said, it's really one of the foundations of health, to address this. And that's why I always ask about, how long do you sleep? What's the quality of your sleep? With every patient, regardless if they raise this as a problem or not. And to optimize your sleep is really one of the main ways that you can improve your health overall.
And as you said, it's not just your physical health, but also your mental disposition and anxiety or depression or disorders that are related, such as that.
And even, as I said, like even on a milder level, people who are chronically sleep deprived often report like feeling just more irritable, just feeling more emotional or more emotionally out of control, and maybe not thinking as clearly. And by helping them get better sleep, they just feel emotionally more stable and balanced and ready to kind of take on the challenges that life always presents us.
So would you have a couple of suggestions people could follow if they're experiencing some sort of sleep or breathing disorders?
Yeah, I would say for as I mentioned before, developing a relaxing evening routine is one of the key things you can do. So that might look different for different people. Some people like to have, say, a warm bath and then maybe do a bit of stretching and go to bed. Certainly, turning off the television, the tablet, the smartphone, trying to do less screen time before bed is really important to just kind of create that sort of calming routine before bed. Maybe reading something that's, uplifting, as well as, making sure too that your bedroom is quite dark and maybe on the cool side. Those are conditions for melatonin, that sleep hormone, to be released. You really need to be in a very dark room. So if you have even like your clock radio by your head, it'd be probably a good idea to move it further away from your sort of, eyesight. So having that, yeah, so you can, yeah.
That bright red or blue is possibly disrupting your sleep.
Yeah, even though you think, oh, how could that possibly have an effect? But our melatonin release is very sensitive to even small amounts of light, even with your eyes closed. So it's important to have, in an urban center, that can be difficult. I mean, you might have to change the kind of drapes you have or window coverings to block out, just the street lighting. Trying to create really a dark place for you to sleep can make a huge difference.
Along that line, then, if you're having trouble sleeping, I imagine it's not a good idea to go to a well-lit room and do some reading.
No. No. If you need to, say you get up in the night and you're like, oh, I'm really awake and I need to do something, then try to keep the lighting level as low as possible. Or if you need to get up in the night to go to the bathroom, for example, again, if you need a night light or, to guide your way, that's fine, but not to turn the lights on as much as possible. So, trying to keep it dark and cool, as I mentioned. And, and a couple of other things that some people find surprising, but, there are some foods that actually you can eat in the evening that actually contain melatonin, as well as tryptophan, which is something that melatonin is made out of. So things like tart dried cherries, for example, one of the only food sources of melatonin. So you could eat a handful of dried cherries before you go to bed. Bananas have potassium and tryptophan in it, which are relaxing and help your body make melatonin. So there are different foods you could actually eat in the evening. Not too close to bedtime, but that could help you actually get to sleep better.
Those are some great ideas, great tips.
Yeah, and also, I recommend people to go online, and there's so many guided meditations, breathing exercises that you can access for free online to help you. So maybe you could play, a little meditation or relaxation exercise before you go to bed. That also can be quite effective to help you just kind of relax into sleep.
Right. But not to do it maybe with the computer, or if you wake up in the middle of the night, don't go turn on your computer, because then you're stimulating you and providing that light source.
Yeah, no, you don't want to do that.
Yeah. If someone were looking to find a naturopathic doctor, what should they look for then?
Well, as I mentioned before, in a province or state where naturopaths are licensed, you definitely want to ensure that they have graduated from an accredited college and have, gone through the requirements to obtain a license. In other jurisdictions, you probably just need to probe a little bit more as far as what kind of education they've had, what kind of experience, and so it's maybe a little bit trickier in other provinces outside of Ontario and the other provinces where naturopaths are licensed. But if you're seeing a licensed naturopath, you can be assured that they've received, the minimum of 7 years post-secondary education, and have met the requirements to be licensed in your jurisdiction.
So you're looking for somebody with the official designation of being a naturopathic doctor.
Yeah. So they have the ND after their name, and usually there's something on their wall of their office, indicating that they are licensed to practice in that jurisdiction.
Okay. Now, if listeners want to get in touch with you, how can they do that?
Probably the easiest way is through my website, which is called alchemymed.com, or on Twitter, and it's Dr. Meyer ND. And those are two, easy ways to get in touch with me. I do practice in downtown Toronto.
Okay. Could you spell the website address for us?
Sure. It's alchemymed.com.
And all the information about you and contacting you is through that site.
Yeah, exactly. And I'm happy to answer questions people might have after this broadcast.
Fantastic. Well, Dr. Meyer, I'd like to thank you very much for your time today and sharing your expertise to help listeners on these issues of sleep and breathing disorders.
Well, thank you, Paul. Thanks for inviting me.
Thank you. It was our pleasure. Bye-bye.
Bye.